So now we've heard some very interesting and profound insights on urban health. Let's pivot to another aspect of public health, that is child health, and a very specific section, something that begins in very early childhood, begins from conception rather, and has an impact throughout the duration well into adulthood. So starting with conception, next. Right. So, the objective of my presentation today is to draw our attention, see one aspect of child health in a new perspective. This aspect needs a lot of attention because although it's one of the key components, one of the 4Ds that we address through our child health program, but it is something that needs a lot more effort in terms of standardization, in terms of convergence, working with other departments. So, beginning with, let's first look at child development again. Child development is a very dynamic process that involves genetic, brain, cognitive, emotional, and behavioral components, interaction of these components, right from conception to the first 24 months, the first 1,000 days, as we say, in a child's life. And the interaction of these components is what determines how the quality of child's life, the development of child is going to be. And any significant, any persistent disruption, there are a lot of risk factors, biological, non-biological, environmental risk factors that can affect the survival and development of a child in a positive way or in a negative way. And it is during this period that nurturing care, the first 3 years of life, the nurturing care is very important to not only ensure the child's survival, but to also ensure a child's development and protecting them from the worst effects of adversity. So what are the components of nurturing care framework? One is good health, so protecting the child from infections, from injury, from trauma. The second is child nutrition, so providing them, beginning with breastfeeding, moving on to complementary nutrition, and then nutrition that is in macro and in micronutrient terms. Then providing the child adequate opportunities to learn, providing a safe and a secure environment, and providing responsive parenting. So wherein the parent or the caregiver is attuned to every aspect, every verbal, non-verbal communication from the child, and the parent uses every opportunity, whether they are feeding the child, whether they are dressing the child, or they're spending any form of time with the child, that they are properly engaged with them. Such that the child is also engaged, the child is also getting stimulated. So if there is any gap in any of these components, or if there is any significant or persistent disruption, the child's development gets affected. And these negative effects, they may be seen in the form of developmental delays, which can, if not addressed well in time, they can progress to significant disabilities that may persist for the entire duration of their life, and not just affect them, but also their families. And here, some children are more at risk. So who are those children? Children who are born preterm, children who are born underweight, children whose families have had history of developmental delays earlier. So, or children who have been admitted to the NICU or SNCU, so these children are more at risk. Next. So, amongst development issues, let's look at neurodevelopmental delays. These are some of the 6 major developmental delays that are seen. Talking about autism spectrum disorder. So, autism spectrum disorder is a condition in which there are three key aspects of the child, are affected. One is communication, one is behavior, and the other is repetitive or restricted behavior. But essentially, it is a condition where the child's ability to communicate and to relate to others is affected. So here, numerous studies have shown that 1 in 100 children worldwide and in India, about 1 to 1.2 children per 100 children amongst the age group of 2 to 9 years are affected. Similarly, if we look at specific learning disabilities, then worldwide the prevalence ranges from 5 to 15%. And in India, nearly 8% of the children may have specific learning disabilities. If we look at intellectual disabilities, so there the prevalence in India is ranging from like 1 to 3%. And it is after depressive and anxiety disorders, it's the third most common and daily causing condition amongst the developmental delays. Then looking at cerebral palsy, global developmental delays, and speech and language disabilities, if you look at this picture, we can see that there are studies that show us global prevalence, that show us maybe some data at the national level, but we don't see a whole lot of data on regional or state level. So if we were to know, if we were to try to ascertain that what is the burden of developmental disabilities at state level in Tamil Nadu today, or for that matter at district level, it is, we only have to go through extrapolation of what is the available prevalence rates. But the ideal situation would be where our health system itself is able to track children and is able to tell us that how many children do we have who are at risk, who are identified, and who are managed for developmental delays. Another thing is that neurodevelopmental delays have the scope if we have the skilled people, if we have the right system. Neurodevelopmental delays can be diagnosed as early as 2 years of age. This is, I'm talking about ASD. So ASD or autism spectrum disorder is something that can be diagnosed as early as even less than 2 years, maybe 18 months. But the average age of identification is usually after 4 years, by the time where the golden period during which we could have stimulated, okay. Next. So what we're trying to see is that neurodevelopmental delays take root in early childhood and they persist into adulthood and affect the quality of life. They often occur along with a lot of other neurological and non-neurological conditions that may often mask and impair the identification of neurodevelopmental delays. The ideal time is in the first 3 years when the brain has the capacity to change, adapt, and form new pathways. And early identification and habilitation will not only help in addressing these risk factors, but also help in mainstreaming of the child. Next. So amongst the existing public health programs, we have the first 5 pillars of the India Newborn Action Plan. It addresses the survival of the child very well. It is the programs like the Mother and Child Protection Card, HBNC, HBYC, routine immunization, which look at strengthening of the child health beyond just the survival aspect. So we do have programs that can identify, that can prevent, and that can identify neurodevelopmental delays. So what are the challenges? Is it going smoothly? Next. So the challenges that we face in the current system is, if we look at tertiary level, there are a multitude of tools for identification, for management, but across public sector, private sector, across the different levels of healthcare, different protocols are followed. So there is no uniformity. There is a need for uniformity. There is a need of consensus that if a child is identified with neurodevelopmental delays at the community level, the same thing should be endorsed by the medical officer at the PHC. It should be endorsed by the RBSK officer, by the RBSK team, by the DEIC. There should be uniformity. So say if a VHN or an Anganwadi worker is identifying someone with a condition, but she goes to the pediatrician is saying, no, your child is normal, you can take them home. That situation is unfortunately happening and we need to address that. So there is a dearth of knowledge, orientation amongst the frontline workers, amongst the medical officers, and even amongst pediatricians. Not all pediatricians are development pediatricians. So they do need to be oriented on development of a child. So we need to create modules, we need to build their capacity in identifying, managing, and follow up of these children. Currently, the DEICs address all the 4Ds: disease, deficiency, disability, delays. So there is a lot of, there isn't enough time to address even the current load of children with developmental delays. So we need a system where not only does the identification improve at community level, but there is also better filtration at block level, so that only the children who need advanced care can go to DICs, while rest of the management can continue at block level. And it is much more convenient for the parents, and we can also ensure that the therapy compliance is also ensured. The other challenges are that there is very little awareness, there is a lot of stigma around identifying children with developmental delays, and most of the current therapy settings do not really involve parents as much. While they do take away their time, they have to spend an entire day, take leave from work or lose pay, but they aren't involved as much in the therapy. And therapy, in case of developmental delays, is not just limited to the half an hour or the 1 hour they spend in the therapy center. Rather, it needs to be something that is done at every interaction point with the child. So how do we address this? Next. So what we need to have is a very convergent and a streamlined public ecosystem, wherein not only the public health system, but also there is partnership, there's convergence with the ICDS, with the differently abled, with the education system, because these are the different partners, these are the different stakeholders that are responsible for a child's welfare from birth till 18 years of age. So first and most important is standardization of care pathway with convergence. So multidisciplinary intervention and standardized protocols for all the aspects of its management. Second is comprehensive system strengthening, starting from community level, where we build capacity of the frontline workers, medical officers, and program managers, mentoring of the DEICs, and an integrated mechanism for screening, referral, and tracking of progress. And third, and most importantly, is empowering caregivers to become their children's therapists. We give them the resource material, we give them the platform for learning about disability, learning about developmental delays, learning how to raise children with special needs, and to learn about what are the different support systems that are there, interact with peers, interact with other parents in similar condition. So next. So if we look at the life cycle of the programs, starting with HBNC, HBYC, and RI sessions, that is where the identification of the developmental delays can happen, followed by ICDS centers, where not only delays can be identified, but also the school readiness of a child can be assessed. Then comes the schools, where the teachers can also play a role, and all of these can be a source of referral for the RBSK teams, and RBSK teams refer to the DEICs. The DEICs can manage some of the conditions, while children who may not require as much intense treatment or who have milder forms of delays can be back referred to the block level or community-based centers. And for all of these facilities, both for district and for block level, we need to have platforms that can support the parents. Next. Last but not the least, sir, I would request you to kindly listen to this pay heed to this humble suggestion, that while we can have universal screening, capacity building for all the children and caregivers, RI sessions form a very important opportunity for not only vaccination of a child, but also for growth monitoring and monitoring the developmental delays using the MCP card, where we note the RI milestones. So from birth to 24 months of age, you at 6 weeks, 10 weeks, 14 weeks, 9 months, and from 16 to 24 months of age, these key milestones are also very important in terms of development of a child. So these platforms which are already existing in our current public health systems can be a very effective and a very simple approach for identifying delays in a simple, in a practical and a convergent way. So this is the thought I'd like to leave you with. Thank you very much for your time. Thank you for the opportunity.
We request additional PHC sir to felicitate Dr. Pooja, UNICEF consultant. Dr. Pooja.
Dr. Pooja is continuously working with us both on immunization and urban services. We appreciate her on behalf of the directorate. Thank you.